Hi everyone, I'm Dr. Cole with Mid-Atlantic Chiropractic, and today I'll be talking about 3 people I will absolutely not adjust without x-rays and a thorough exam. So the first one is someone that's experiencing new numbness, tingling, or paresthesia. The reason why this is important is there can be a number of factors as to why that person is experiencing that. And so number one is that there's some kind of nerve interference present. And in chiropractic, we call that a subluxation. And what it means is that we have joint dysfunction in the spine, which is affecting the nerves that go to the body. And those nerves can be compressed, they can be irritated, they can be inflamed, there can be a muscle that's impacting that nerve as well. And so when there is nerve interference present, the brain and the rest of the body may feel that there is tingling, numbness, paresthesia, lack of sensation, and as a result, we know that we need to track down the exact root cause before we perform any adjustments. Number 2 is someone that's been in a recent trauma, such as a car accident. During car accidents, most times we don't actually injure the bones, meaning we don't fracture the bones. Those bones can move or shift a tiny little bit, but most commonly what happens is we experience soft tissue damage, and that can be to the nerves, that can be to the muscles, and most people don't feel pain right away. Due to the tissue damage to those muscles, you'll experience what's called delayed onset muscle soreness, meaning we may have been in a low impact car injury, and 3 days later, that's when we start to develop that soreness in the neck. Just like working out at the gym, if you just hit your brand new PR, you might not feel sore that day, might not feel sore the next day, but on that third day, that's when that soreness typically starts. And lastly, someone who just says, crack me anywhere. So the purpose of our thorough exam is to identify where these subluxations lie and where that nerve interference is. From there, we can correlate that with our chiropractic exam, orthopedic exam, and neurological exam to determine exactly where and how to adjust. So we don't just willy-nilly adjust the same way on every single person or just every single joint just to do it. The cracking sound isn't things necessarily moving in or out of place, but what it is opening up and decreasing the pressure around where those nerves exit. And so just like when you have a vacuum, and then you open that vacuum, we hear a release of gas or air. Same thing goes for the joint, and our goal is to decrease that joint pressure around the nerve. And so if your chiropractor will adjust you without doing an exam, without doing a thorough history, and without taking x-rays, I would be cautious. I wanna make sure that I'm in the best hands possible. And for me, that means a chiropractor that takes x-rays and does those following steps: chiropractic exam, neurological exam, and orthopedic exam. The most important thing is the history, because we need to know exactly where, what, how, and why things are happening the way they are. So if you have any questions, please feel free to ask in the comments below. I am Dr. Cole with Mid-Atlantic Chiropractic. I look forward to hearing from you all in the future. Thank you very much, and I hope you have a happy new year.